I'm Hussam Muntasser. I'm consultant ophthalmic surgeon. I work as a clinical lead at Newmedica Cheshire. I work with colleagues Mr. Kunal Gadvi, Mr. Ken Yao, and our operations director is Ms. Natalie Park. When a glaucoma patient arrives to our clinic, we offer them a complete package of tests that includes testing their visual acuity, eye pressure. We use the Humphreys Visual Field Analyzer to test their visual field. We have the Heidelberg Spectralis OCT with special glaucoma module to assess their eye and look for evidence for glaucoma. The patient is then seen either by myself or my colleague, Mr. Ken Yao. So we offer our services to both NHS and private patients. That includes cataract surgery. We provide standard and advanced technology lenses or premium lenses to our private patients. We also offer treatment options for glaucoma. That includes the latest SLT laser therapy, as well as drops therapy. And for our patients who would be undergoing cataract surgery, we can combine this with a mixed procedure to reduce the number of eye drops they require to control the pressure of their eyes for glaucoma. Also provide oculoplastic surgical procedures to our patients, again, NHS and private. This includes procedures to correct the position of the eyelids. For example, if you have a droppy eyelid, you can have the operation to correct that. Or if there are little lumps and bumps around the eyes and you want them removed, this can be done here in our clinic. So the best part of our job is to actually see that satisfaction in our patients' eyes when we see that they regain their independence. The reason we joined Newmedica in this clinic is that we are able to offer the best to every patient we treat here. Whether that's cataract patients where we can offer them the best lenses, the best experience, where the patients know that they are being looked after by the same clinician, the same doctor, to guarantee continuity of care.